Get Right is brought to you by CBD Sports Solutions. CBD Sports Solutions is 100% THC free and made right here in Colorado. It is animal and vegan safe. The anti-inflammatory properties assist with pain, heart health, and digestion. The solutions come in gummy, droplet, salve, and pill form. Personally, I have been taking the pill every day for the past couple of weeks for my low back pain. Been able to get off NSAIDs. It's been a wonderful thing. They're bad for your body. You don't want that trash in you. Take something natural like CBD Sports Solutions. Please visit www.cbdsportsolutions.com to read about the product. Text Get Right to 303-249-4324 to receive 20% off your first order. That's Get Right to 303-249-4324.
Yeah.
What's going on, Denver? What's going on, Metro? We are here live in the studio for the Get Right Mind Body Podcast. I'm here once again with Leo Pop.
We're back, baby.
We are back. We're going to talk about all things mind, body, health, fitness, success. Let's go.
My girl asked me what I wanted out of life and shit. I told her a place to raise my kids where police would not approach them, and they can rest in peace without circles from the vultures and never be beaten just for speaking on their culture. And this to me seems like the way that life's supposed to be in every day.
What's crack-a-lackin', Leo?
I'm perfect.
You're perfect?
Nah,
In every
never.
way?
No, I've been good. How you been? I've been busy with schoolwork, and now I'm done school. You're done school.
Yep.
So now we're able to do this a little more often.
Yeah, it's excellent.
Back.
We are back. We are back in the
Yeah.
studio. Feels good. Yeah, finally got through that semester. It was brutal.
That was brutal.
Yeah.
That was something.
Leo took 5 classes for all of you out there. So
Made it.
we were able to do the podcast, but we were a little limited on time. He had to be selfish and choose grades over the podcast. So, you guys can blame him. I personally would have come in with 5 classes and recorded in between and just slept on the floor right here of the studio.
Got to do what it takes.
But,
man.
it is what it is. Either way, we are back, man, we're ready to keep this thing going. So here we are back, and I personally have been experienced some things at work that I think have propelled me in my personal life, and this would be taking on more responsibility on the job. Yeah, so it's not a choice I made. It's just the position I accepted. So it's not as if I was like, I am going to take on more. I did by accepting the position, but I'm not expanding my role with inside the previous job I had. I got a new position. It requires me to have more responsibility. And
cool.
Man, I think it's a great thing.
Did they add more responsibilities like since they first started? How did it work?
So yes, so it's just been it's been a building process, basically fortunately the position I am in, the role is getting bigger and expanding more, and so it's nice. It's just it's nice to have to step up to like new challenges. So I like that.
Why don't you tell everybody what you do again?
So I'm a respiratory therapist, and I work at an orthopedic hospital.
Cool.
But it's nice. I like the ortho too. I like with what we learned, what I learned personally last semester, specifically in my athletic prevention and care of athletic injuries class. And being at work and seeing patients heal from orthopedic surgeries, I'm like, you know what? I think I like muscle, bone, tendons, and ligaments, man.
Cool.
Yeah.
How does that incorporate with what you do with pulmonary?
Oh, good question. So basically, we are there in case, if patient everybody there is on oxygen. So we have to manage oxygen.
Gotcha.
Several of the patients go home on oxygen.
Okay.
So we have to set up patients to go home on oxygen.
Okay.
That's a lot of what we do. We're also responsible for the EKGs. So in a large hospital, you would have a respiratory department and an EKG department. And basically the revenue generated by doing the EKGs pays for a department of people that can do EKGs. But in a smaller hospital where you don't do as many EKGs, basically like the respiratory therapy department generally does them.
Okay. Have you been trained on that before, or did they have to train you all like from the beginning?
No, we do learn EKGs in respiratory school, but then outside of that, I've been doing them since one of the first hospitals I worked at was in Alabama and Phoenix City, and they were a small hospital. I was the only therapist on duty, just like I am at the hospital I work now.
Oh, are you?
Yeah.
You have a teamwork. You're the head of a team, aren't
Right.
you?
Yes, exactly.
So
Yeah, but
you got people under you.
It's one per shift.
I see.
Yeah, so including myself. So
You and one more.
no, just me.
Just you.
Yeah.
Okay.
So
Gotcha.
I have to do. I'm like a working lead, basically.
Got
a
it.
working supervisor.
Got it.
I do the same thing except there's additional duties.
Okay.
But
Cool.
yeah, in like a small hospital setting, sometimes it's like considered like a cardiopulmonary department. So at that hospital, I had to do EKGs way back 10 years ago, and I've really been doing them off and on ever since. So it's not that hard.
No,
It's pretty simple. Yeah.
I've had them done for me. So
Doing them, reading them is reading them involves
You have to read
a little
them?
bit more. No, I don't have to read them.
but I bet patients like ask you like how what does it say
every time,
and you're like I can't tell you.
Yeah.
I can't tell you.
they do every time, and
yeah.
like dead honestly, like we're not. It's not that we're not qualified to read it. Like as far as like
You learn how to do it.
we learn how to,
Yeah.
but I would be overstepping my bounds to like give you the results of the reading. It's
Yeah.
same thing like an X-ray tech.
Yeah.
You know, they yes, they can look at an X-ray and kind of tell what's going on, but a radiologist has to read it and like, then they write an impression and then the doctor who ordered the X-ray or whatever, they can then tell that to the patient.
Yeah.
But yeah, it's the same thing. Like any of those jobs, like, you're not really, you'd be overstepping your bounds by like reading, doing an analysis yourself of it, because like, we basically learn, we have to have what's called ACLS, Advanced Cardiac Life Support. And that's where you learn like fatal heart rhythms, like stuff you have to shock, give medications to, stuff like that. But outside of that, there's a lot of like minutia. And so, it's best left to the people that are getting paid
Yeah.
to analyze that stuff. Yeah.
I've
so.
been that person, the patient like that has been the annoying patient that
We all
asks,
do it.
what is it?
Yeah, I basically, if someone's really persistent, I will just be like, I can tell you if it was bad, I would let the doctor know right now. So, if
It's a little,
it's
warning sign for them. Or
it's like, I personally don't think you have anything to worry about, but the doctor really needs to look at it.
they could sue you if. If
I mean,
if you tell them the wrong information.
you also
hospital.
What's huge in the medical field and healthcare is information management. And so you don't want multiple people giving you multiple interpretations of the same test.
True.
So there needs to be like a definitive like reading on everything, and then we can then, tell the patient that information. This is what the doctor saw.
Right.
But yeah, it's very frustrating to patients and family members when they get multiple when they get mixed messages.
Yeah.
You know what I mean?
Yeah.
Like it's like one of the worst things if you've been a patient and two people have told you two different things.
It's a
You're
headache.
like,
what is going on?
What's happening?
Yeah.
Do these
Am I
people not
gonna
know what they're
die?
doing?
Am I going to die? Am I going to live?
It's like an old joke. If you want 3 answers, ask 2 doctors the same question. So it's like you definitely don't want to ask every person that walks in the room hey, how's it look?
Yeah.
Because then you'll get a ton of different responses. So yeah, it's just one of those things. Yeah, man, that is good. Yeah, I'm really enjoying it, and yeah, man, still possibly working towards your route, the PT route.
Yeah.
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 How's that going?
It's good. I have to. I still got like a year and a half left, depending on how the credits pan out. I actually have the situation where I think I have. So I'm taking summer classes now. I'm taking 2 in the summer, and then I think after that I have either 5 or 6 classes left, which should be like 1 semester left. But I have like 4 prereqs, like one into the other, to the next, into the next. So it's kind of annoying because I'm gonna have to, from now on, I'm gonna have to take like 2-3 classes at a time to finish, and it's probably gonna take maybe 3 more semesters. So the summer plus 3 more, which is a little bit annoying. But after that, planning to apply to PT school.
Which school?
Not sure yet, but I'm gonna be applying probably in Florida. I'm thinking of.
Oh, you're not staying here?
I mean, I'm applying here too.
Oh, okay.
But it depends, honestly, when you get in. It's pretty competitive, so yeah. So that's pretty much it. And still got to do shadowing. I got to shadow hospitals. Got to shadow private clinics. That's part of the application process.
Yeah. I was looking it up the other day.
Are you thinking of PT at all, or?
Yeah.
Or?
Honestly, I think when I graduate, I'll be set up to one of 3 paths, and that would be either PA, PT, or get a Master's of Health Business Administration.
My buddy's doing that.
Really?
The health administrator. He actually really likes it. What he's doing now is he works for like a technology company that, like, for surgeries, and then he goes into the actual surgeries, and then he literally advises the doctor performing surgery during the surgery, like how the equipment works. I mean, the doctor like has a rough understanding, but my friend knows the technology in depth, so he's kind of assisting him
in that.
Yeah, my
buddy. Yeah, I got a buddy that got a degree in, I want to say, like, biology from UGA, and he stopped there and just started becoming like a pharmaceutical rep, and he now goes into the surgeries, like eye surgeries, and like he's a rep for the surgical equipment. And
that's
like
exactly what he's a rep. That's
yeah. So, man, he makes 6 figures a year. He makes more than anybody. Yeah, about anybody else I know. Like, that's like a peer of mine. I can't think of anybody else that makes as much of him as him. I mean, he really kills it, and he's a real natural at it. But yeah, there's good money in that. It's very high pressure, and he was just like a regular eye, like he would sell like contact lenses, like he was a drug rep, but it was it was all eye stuff. But now it's into surgery, and he's like, yeah, you can't fake it till you make it in there.
No,
you gotta
know what you're doing.
You gotta know what you're doing. You better know your product. But yeah, man,
that's good money.
He loves it, and yeah, it's great money. Yeah, I don't know if the whole salesman thing that I don't know if I could do, because it's that old thing of like, every day you go to work, you have 0 sales. You always start at the bottom.
You gotta hustle.
you gotta hustle every single day.
That's kind of good. I mean, keeps you motivated, keeps you on top of your stuff. So
it does.
I think it's good.
It does. And I guess
I think it's good to have sales experience in anything you do, because then you can always apply it to something else. Once you're a good salesman,
that's true.
You can apply it anywhere.
Yeah, even just watching him work, like, I don't know. It's just in like a normal situation.
Does he work at your hospital?
No.
You've just seen him work?
No, I haven't seen him like work, but just seeing him work his salesman skills in like normal situations, just like his day-to-day interactions, it comes so effortlessly. Yeah. You can just see him, like, he just has this natural rapport with people. He gets to ask a few questions, gets to know him, throws in a little bit of personal information about himself, blah blah blah, and then, like, just there's a subtle, like, ask that he'll get just a little bit something out of like every situation, and it doesn't really even try hard. It's just funny watching him work. Yeah, and also he has friends. Some of his friends are also in sales, and like salesmen they're a fun lot. Like they always say, like one of the best conventions you can go to is like a salesman convention, because salesmen they're just very extroverted,
Yeah.
you know, and there's a lot of characters, and yeah, his buddies, man, they're a lot of fun too.
That's
yeah,
cool.
They're a good crew to hang out with for sure. Yep.
Yeah. Cool.
Yeah, man.
I was actually talking to my friend, the one that's the sales rep.
Yeah.
He was originally going for physical therapy, and then he's like, "There's no money in PT. Like, it's not in his perspective. It's like it's not worth going to PT school because of how much money it is and how much you make per year. I think PT school on average is like between, depends where you go, but like 80,000 to 150,000, something in that ballpark. And PTs probably make an average like 80,000 a year. So,
yeah, it's a surprisingly lower amount of money
Yeah.
than what you would think.
but I think people with that perspective, I think they're not looking at the big picture, because you're not getting a degree to only work for a year. You know, like you have that degree for your whole life.
Right.
And that's just like the minimum. That's the starting pay. You can like open up your own business. You know,
Yeah.
you can have people under you. Like I'm following this PT on Instagram and YouTube. He like makes a bunch of like inspirational videos, and like
That's
he
awesome.
actually holds conventions to like other PTs, telling them how to expand their business, how to make sales, how to make their business more like customer friendly, how to just be more personable, just a bunch of, it's like he's like doing self-development essentially with PTs.
And I mean,
So
that's what I like about it. Like,
Me too.
honestly, it's less competitive and probably pay more to actually be a PA than a PT.
yeah,
And I had a buddy that's like, dude, yeah, don't go into PT.
Yeah. But I like PT,
I like it
honestly.
too. Yeah,
Yeah,
I
it's
like
dope.
it too. Yeah,
I like
it's
PT.
awesome. Yeah.
yeah,
But yeah, it seems like the field. I don't know. It seems like the field maybe. I don't know at what point it changed, or if it's just always been a lower paying medical job, because it is a lot of school.
it is.
But you know,
But I mean,
I've seen 100 different doctors in the hospital, and like nobody's calling a PT at 2 a.m. because like a
Right.
patient's going down.
yeah,
You know what I mean? So it's not like the liability. Like, I mean, obviously you can injure somebody, but you're not prescribing like typical. You're not prescribing,
you're not prescribing
like
medicine.
meds.
You're
yeah.
prescribing exercise, but
So
different,
there's
yeah.
also like the liability is different, and
Yeah.
probably what you pay in liability insurance.
yeah,
Yeah, it's more of a Monday through Friday 9 to 5 job. So it's like,
Yeah.
that's cool. Like, cause the medical field, like, oh gosh, I talked to a doctor the other day, at work, and they don't have to work like 24-hour shifts at our hospital, but like they have to take call, you know, and
they have to be on call at all. Like
not at all times.
Not
They
at all
rotate
times.
it. So there's like a group that sees like maybe like 80% of our patients, like one physician group.
Yeah.
And I don't know how many people are in it, but you know, they rotate shifts, they rotate call, but you know, it seems like they work about 12 hours. It seems like they come in maybe a little later than us, maybe like, you know, 7 to 6 instead of
Yeah.
like 6 to 6 later than what I come in.
right.
But I was talking to one the other day, and she said when she gets home, she has to do 3 hours of charting after every shift.
That's insane.
Yeah, that's
So
crazy.
it's like a 15-hour day. And
Yeah. I
Wow.
was like, you've got to be kidding me.
Well, that's where the money comes in.
Yeah.
Another
And
thing-
the liability. Well, that's what you
Yeah.
get paid a lot. The higher the risk of patient like harm, I think the higher the pay a lot of times, unless you're
Yeah.
like an EMT.
I mean, yeah. I mean, it makes sense that they get paid less also, because like they don't have to do residency and internships. Well, they do have to do internships, but not residency. So it is less schooling. Doctors do 4 years, PTs do 3.
Yeah.
I mean, I guess you get paid for what you do. right?
Yeah. You get paid more to save lives, but I mean, it's got to be rewarding to like get somebody from like the state they're in back to like fully functioning, or
Yeah.
to like a much more functional state where they're increase their activities of daily living, and like it's rewarding seeing it in a small way in our hospital
Yeah.
of like these people come in and something's been bothering them sometimes for years, you
Yeah,
know, and
yeah.
like they come in, have a surgery, and like they're back home and on their way to healing,
It's like all of a sudden you're back.
It's awesome.
Like,
it's like
it's out of
because
nowhere.
A bad hip will ruin your life.
Oh,
and
people die early because they break their hip. Like that's the thing.
So I like that aspect.
Yeah.
It's different than like a lot of what respiratory does because we're involved in. We have a lot of patients with lung diseases, obviously, which most lung diseases are don't get better, and we deal with a lot of like ventilator patients, so patients on life support, whether that's somebody getting out of surgery and we're just recovering them, basically, or someone that's literally like circling the drain, for lack of a better term. So you see a lot of people go down. Now, you do save a lot of lives, so that is rewarding. But you also see it gets to you sometimes just seeing sick people like not doing well.
What do you do to deal with like the mental aspect of that, like seeing people go down a little?
Honestly, we're a little luckier than the nurses because we aren't as close. We don't spend as much time. So like an ICU nurse would have one or two patients. If they get what's called like a tripled, like they have 3 patients, that's like I'm about to quit this job. Like it's that bad, to have 3 patients and you're an ICU nurse. I guess depending on the ICU, but like we'd be inside like an entire ICU plus maybe a floor, depending on where you work. So
you're kind of in and out. You're not
exactly.
You're not like
exactly. We basically depending on where you work, you check on the patient.
Yeah.
Depending on the workflow, like either between 3 to 6 times a shift, and then as needed in between. Okay. But you don't get as close to the family and the patient,
right?
So it's not quite as bad as what the nurses have to deal with. Yeah. But when somebody's not doing well and the family's all there and they're hurting, it hurts. It hurts. Just hurts seeing them hurt.
Yeah. To see it consistently too must not be fun. Oh.
Well, we always get a mixed bag. Yeah. So that's what's
because you help
bad
some
about
and
it.
you don't help some.
There are places you could work, like really bad places, like maybe you could work at Children's Hospital in like the cardiac ICU, where that's really sad.
That's sad.
Or you could
that's
work
sad.
like the burn unit, which is horribly sad. But the most probably what we do, it's a bit of a mixed bag. There are people like we're putting in the breathing tube on people that are doing really, really poorly, and we're also, the same, 20 minutes later, you could be taking the breathing tube out of somebody that's doing great.
True.
And, they could be, on the floor the next day, so
True.
We get it's a mixed bag. So it always kind of levels out, in my opinion, my experience. So
I know your girlfriend works at Children's Hospital.
Yeah, she does.
What does she do? Is she ICU or?
Yeah, she's in the cardiac ICU at Children's. Yeah. So she's got a whole different experience. Like that's real. Not to say what I do isn't, but
of course,
that's real raw.
Yeah, nurses I think
emotion.
have it. Nurses I feel like have it even harder than doctors at times, like, because they're the ones that are like with the patients.
Yeah.
More than anybody else. They
spend the most time with the patient.
It's hard
of anybody in the hospital. Yeah, like they spend the most time with the patient, and with the family for that matter. The doctor has to have the tough conversation when that conversation has to happen. But the nurse is like generally there, and a part of that conversation. Like, so it's
rough.
It's a rough. Yeah, it is a rough thing, man. I feel bad. Yeah. I feel bad for nurses when patients aren't doing well.
Yeah, and then the patients sometimes complain to the nurses while the nurses are trying to
always
do their best. And
that's a standard. You have people that are
you got to be very resilient.
You have people that are there trying to go along with the program and get better, and you have people that are like, who knows why they're there. They could be there because of some lifestyle choice, and they just wake up in a hospital and they don't want to be there.
Yeah.
They're just trying to get out.
And then like if they go into surgery, like I've heard stories where patients become paranoid after the anesthesia. Yep. So they're trying to they're attacking the nurses. They're they're trying to take the tubes out, whatever.
Yep. That happens.
So it's a mess
all the time. Yeah. And you don't know a lot of times patients, you may or may not know exactly what their history is, depending on where you work and how they've come in. So you don't know if somebody's like, 2 bottles of vodka a day, and like they're coming out of surgery and all of a sudden they start withdrawing. You don't know what's going on, or, or, you don't know if it's the anesthesia, so you're always having to like kind of tweak things and like dial the medications and to manage them. So they don't hurt themselves or others.
Yeah.
But,
On a lighter note.
On a lighter note.
So.
On a lighter note, we are back.
We are back.
Back in action.
Yeah. Hopefully we'll be doing this once a week during the semester. Maybe we'll get in a few more times because now we're gonna have a lighter workload.
Yeah, I'm out.
So
I'm done for the summer, man.
Yeah, Jeff's done for the summer. I have 2 summer classes, but we're still gonna try to get in and film a few episodes. The show.
Yep, that's right. We will be filming, or we will be filming, but we're gonna continue on our same path. We're gonna be bringing some stuff to the table here. We're gonna be bringing in some interesting people, and we're gonna be continuing this podcast, the Get Right Mind Body podcast. A lot of stuff is coming up this summer. And stuff coming up in the fall, and we can't wait to bring it to you guys.
Stay tuned.
Stay tuned, everybody, and thanks for listening.